My name's Samantha Harries and I graduated from McTimoney College of Chiropractic at the end of 2012. I currently split my time as a chiropractor between two locations. I work as an associate as part of a team of 4 chiropractors in a private clinic in Fleet in Hampshire, where I've been for over 7 years. And in May this year I also began working for an organisation called Back Active, and we are a team of chiropractors, physiotherapists and osteopaths who provide musculoskeletal care to patients as part of an integrated service within the NHS in North Hampshire. My career path to where I am now has not been a particularly direct one. When I was at school, I didn't know what I wanted to do work-wise, so I decided to do a degree in equine management. I'd always had an interest in horses, so it seemed like a logical step. And during my first year placement at a yard, I met an equine chiropractor and decided that that was the career path I wanted to take. After graduating with an equine degree, I started the 5-year Masters in Human Chiropractic from McTimoney College in Abingdon, with a view to going on to do the Animal Masters afterwards. However, in my second year, my circumstances changed. I left my job as a recruitment consultant, which I've been doing alongside my studies. I sold my horse and generally lost interest in anything to do with horses. I needed to find some work though, and so decided to make use of my massage qualification, which I'd obtained prior to starting the Masters. So I set up as a self-employed massage therapist and began working at a number of locations, including a neurological physiotherapy clinic in London. This was a great opportunity for me as I was working as part of a team of physiotherapists, personal trainers and other massage therapists, assisting in the rehabilitation of patients who'd suffered spinal cord injuries, had strokes or had other neurological conditions. And I found this job immensely rewarding and really valued the opportunity to work as part of a team of health professionals. When I finished my Masters in 2012, I began gradually transitioning from massage therapist to chiropractor and left the role at the neurophysio clinic at the end of 2013. In 2014, I began roles as an associate chiropractor in clinics in Reading and Fleet, and I left the clinic in Reading after 2 years and took on more hours in Fleet, which is where I still work now. In 2020, as a result of the COVID-19 pandemic, my hours in the clinic were significantly reduced, and this meant that I had the opportunity to look for additional roles elsewhere. And in March this year, I saw the NHS role advertised on a chiropractic Facebook page. It was always a long-term ambition of mine to work for the NHS, and so I jumped at the chance to apply for the job, and I began the role that I'm currently in with Back Active in May this year. In terms of what I enjoy about my current role with the NHS and how I fit it in with private practice, I find the NHS role very rewarding, as you can make a real difference to people's lives who otherwise may not be able to afford to pay for this kind of treatment. There's a huge variety in the patients that I see and their reasons for being referred to us. Some patients do well with a little reassurance or guidance, others require a bit more support. And some patients won't do well with our service, in which case we have options available to us, including referring them on for further investigation or treatment with departments such as the orthopaedic team or to the chronic pain service. And this is the advantage of being part of an integrated service within the NHS. In line with current science and guidelines, our focus is less on patients being the passive recipients of treatments such as manipulation, massage and acupuncture, although we do use these if necessary, and more towards them being active participants in their care. Through shared decision-making and educating patients on self-management, we can alleviate some of the strain on the other NHS services and prevent patients from going on to long waiting lists for inappropriate care. I also enjoy the contrast of slightly more relaxed atmosphere that comes with private practice. I obviously have the luxury of time when seeing private patients and have a bit more flexibility in my diary. Both my private and NHS work is based around pain education and rehabilitation, and so having a slightly longer appointment enables me to have more in-depth conversations with patients about their beliefs and their concerns about their pain, and together we can develop a long-term treatment strategy that's meaningful to them. If I could offer any advice to others wanting to take on a similar role, I would encourage you to join the relevant faculty with the Royal College, and that way you can make contacts with colleagues who share your area of interest. There may not be a role available at the time, but by making these contacts with those who work in the area that you're interested in, you'll be in the best possible position if a job does come up. It's also really helpful to keep your knowledge base up to date for the area you want to work in, and this could be in the form of postgraduate qualifications or weekend courses and seminars. One thing I've learned in particular over the last 18 months is the importance of investing in further education. And for the last few years, I've become particularly interested in pain science and have been undertaking the Royal College's Diploma in Pain Management. I found that social media can also be particularly good when looking for job opportunities. As I said, I found the job with the NHS on Facebook, but it can also be a really good resource for networking with other health professionals. Finding a job where there's a good support network and an opportunity to learn from others is also immensely helpful, and not just chiropractors, but also like-minded physiotherapists and osteopaths too. I hope you found my vlog on my roles in private practice in the NHS helpful, and I'd be more than happy to answer any questions you may have.